hello, you must be Chris.
Yeah,
Hello, my name's Emma, I'm one of the doctors.
Hi.
I've been asked to have a look at your eyes today. Are you happy with that?
Yeah.
Is this your mum?
Yeah, that's right.
Are you happy for me to do
fine.
that? Okay, so what I'm going to do first of all is just have a look myself at your eyes, and then
Okay.
we'll move on to doing some testing
Okay.
of your eyes. Okay. Just try looking straight forward.
Okay.
Mm. Okay, brilliant. Just go around the back of you. So what I'd like to do first of all, Chris, is just to check your vision in each eye.
Mhm.
So if I could ask you first of all to use this hand to cover up your right eye, and then if you could tell me whether you can read any of the text here.
Yeah. The monster. Sorry.
It's okay.
The monster.
Does it help if it's a bit closer?
The monster run. The monster ran.
Okay.
It's run out the wall.
Okay. And does that appear clear with that eye?
Or
do the letters look a bit fuzzy?
Slightly. How can I say? Slightly. They're not as clear as
They're not clear. Okay. So I'd like to test his vision with a Snellen chart, but we don't have one here today. Now, Chris, could you cover up the left eye and just tell me if you can see
cannot
anything
see
on the
anything at
page?
all.
No. Okay. But still doing that, I'm just going to hold up my fingers and ask you if you can see my fingers at
Okay.
all. So cover your left eye again for me. Can you see any fingers moving?
No.
Okay.
Can't see anything.
And then if you see a light, can you tell me? Can you see any light?
No.
Okay, that's fine. And then just swap eyes for me again. Actually, that's fine because we've done the text on that side, so you can relax for a minute. So do you normally have any glasses?
Yeah.
Do you have them with you?
Yes.
Yeah, they're here.
Okay, great. Okay, let's have a little look at those. Okay, and then I think it's important for us to check how well you can see with those on.
Yeah.
Would you mind popping
Yeah.
those on for me? And we'll have another look. And then without covering up any eyes, let's see, which page? Always opens on that one. Do you want to hold it actually at the distance that's convenient for
Yeah.
you and see what you can read?
Shh, said Gran. I can see the monster's tail.
Okay.
Gran pulled the monster's tail. Got you, she said.
And is that clearer now with the glasses than before
course, yeah.
when I tested it? Okay, brilliant. If with your glasses off, are you comfortable seeing my finger held up here, do you think?
Yes.
Can you try that?
Yeah.
Can you see my finger there?
Yeah.
Okay, so what I'm going to ask you to do now is follow my finger with your eyes, okay?
Okay.
Trying to keep your head facing straight forwards,
Okay.
and keeping your head still, so
Mhm.
about like that. So can you see my finger there?
Yeah.
And does it look like one finger?
Yes.
Okay, and tell me if at any point it starts to look like two fingers or more blurry.
Okay.
Okay, so keep following my finger. Well done. Okay, good. Does it look blurry at all?
No.
Looks the same. Okay. Good. Excellent, that's fine. Give your eyes a rest. What I'm going to do next is just test your pupils. Okay, so that means shining a light quite closely into your eye. Are you happy with that?
Yes.
Okay, so if you just keep looking forwards for me, I'm just going to shine the light into the left eye first. Okay, good. And then I will shine the light into your right eye.
Okay.
It doesn't cause you any discomfort?
No.
Okay. Okay. One more, sorry. Okay. Great. Thank you. I'd also like to perform fundoscopy, but we don't have an ophthalmoscope here with us today, and to check visual fields. Would you like me to go on to do that? Yeah. Okay, so now what we're going to do, I think you've probably done this before, is testing how well you can see things coming in from the side, okay? It's probably best to do it without your glasses if you're comfortable without them on. Is that all right?
Yeah.
Okay. So what I'm going to do is ask you to cover one eye.
Yeah.
We'll do it as we normally would. And then I'm going to wiggle my finger like this, but bringing it in from the side and ask you to say when you can see my finger wiggling.
Okay.
Okay? So if we both cover up our eyes like this, okay, and then keep looking straight at my face. So try not to look at my finger, just look at me, and then tell me when you can see my finger. Okay. And then from this direction?
Yep.
Okay, brilliant. You keep your hand there and I'll just...
Yep.
Okay, good.
Yep.
Okay, brilliant. Now, if you could... I think you're going to be unable to do it on the right-hand side, aren't you? You can't see my finger at all on that side. Okay, that's fine.